assessing EHR use during hospital morning rounds. So there was a study, I actually pulled this from your feed. So there was a study that was done, and they mixed method of collecting information, and what they determined was that across the analysis was that there's, as people are rounding, that these are the three things they found: high degree of variance in the ways teams use EHRs during morning rounds. Number two was pervasive use of workarounds at critical points of care. Third thing was EHRs are not used for information sharing and frequently impede intra-care team communication. I'm sorry. And a fourth one, system design and hospital room settings do not adequately support care team workflow. So interesting findings. To be honest with you, none of those findings really surprised me. So, you know, what can we be doing? What are we doing? What can we be doing to address this specifically, do you think?
I thought the same thing when I read the article. I don't know that any of those things surprise me. I think the real sort of takeaway in that is our inability in healthcare to yet create clinical standard work around the use of the electronic health record. So we've, to sort of turn a phrase, we've kind of paved a cow path instead of sort of saying we're going to do everything a different way. So now that we're using EHRs, and that means we're going to change the way we do morning rounds so that we can integrate the EHR more effectively and not do workarounds. That creates a whole group of risk in and of itself for patients and families. And none of us really want that. But I think we've still sort of got this weird situation where we have clinicians and others who are unwilling to change and unlearn the habits that they already have about how they do morning rounds and other clinical provision of care too. But in this instance, particularly around morning rounds, they're unwilling to sort of change their ways of doing it to integrate the EHR more effectively. And then I think the other part of that is sometimes the EHR doesn't work very well to be able to facilitate the work that they're trying to do too. So it's really sort of two different pieces of this. One is a management engineering effort to make sure that we're using the EHR as much as we can in the workflow, and that the workflow has been modified to adapt to the EHR. And the other one is changing the EHR and doing the informatics stuff that we need to do to make sure that the right data is available when it needs to be used in morning rounds.
Yeah, this is one of those things that it really showcases the leadership of the health system, because this is not just that, it's a team sport. Like you said, it's not just IT. It's, it's standardizing clinical workflows, it's standardizing clinical terminologies, practices, data sharing. It's all those things. It's embedding IT into those rounds. And a couple of CIOs have talked about embedding analytics in those rounds, but also embedding workflow people in those rounds so that they're constantly adapting the EHR and identifying those workarounds that could lead to care gaps, because they are potential care gaps, and these are the kind of things we're trying to eliminate. So it's complex. You can always tell the really well-run healthcare organizations, because you really have to fire. If you're firing on two of those four cylinders, it shows.
Yeah. And mistakes happen and other challenges occur. I mean, I think one of the best things I ever did as a CIO was the least technology thing I ever did as a CIO. And that is, we had a group of really amazing workflow specialists that were part of our team and really spent all their time in the field figuring out how to help clinicians learn how to change their workflow to use the tool more effectively. But at the same time, they brought back the information that they needed to tell the technologists about how to adjust the tool to take better advantage of the workflow. And, it's a people process technology thing, as we've said a million times. If they all work together, it's a beautiful thing. And if you just try to pull on one handle really, really hard, it just doesn't work right.
Yeah. And I'll take the last word on this, which is I tell CIOs all the time on this one: if you're not doing this well, your clinicians are going to be cynical. And then when you start talking about digital and transformation, they're just going to look at you like, are you kidding me? You didn't do the last one well.
Right.
And this is like, this is like we used to say the data center has to always be on every time they turn on the computer. I mean, that's what this is now. You're your workflow has to work for people. You have to be constantly improving it, making them more efficient.